Welcome, everyone. This is Dr. Sultan from Dentistry for Children in Clifton, New Jersey. We will be reviewing tongue and lip ties for children going through speech and/or feeding issues. For those that don't know me, I'm a board-certified pediatric dentist through the American Board of Pediatric Dentistry, a member of the Academy of Laser Dentistry and American Laser Study Club, and a fellow through the American Academy of Pediatric Dentistry. Before beginning this presentation, I would like to acknowledge credit to Dr. Richard Baxter and the Tongue Tie Academy for inspiring to create this video for our patients and parents. So what is a tongue tie? A tongue tie is a too thick, tight, or short remnant of tissue from fetal development under the tongue that restricts normal tongue movement and causes a functional issue. The symptoms the child has are more important than the appearance. A full assessment of related issues is the key to diagnosing a tongue tie. Having a patient stick the tongue out is not the best test to determine the presence of a tongue tie. Elevation or having the patient open wide and lift the tongue to their palate is the best quick test for older children, or lifting the tongue on a baby is the best test. Elevation or lifting the tongue is a critical movement for a key activities of nursing, swallowing, and speaking. A lip tie is a remnant of tissue that is abnormally tight or thick that causes difficulty lifting the lip as required for nursing, feeding, speech, or for cleaning the teeth. It also can cause a gap in the teeth, and if it is wider than 2 millimeters, it may need to be released and will not likely close on its own, especially if another functional issue is present. As I've always said, if it ain't broke, don't fix it. So tongue ties can have variable appearances. Children's tongue ties can appear very tight or mildly tight. The symptoms and functions are much more important than appearance. All these strings under the tongue are causing problems, even ones that don't appear as significant. So what are some current issues with tongue ties? Currently, healthcare providers are not taught about tongue ties in medical, dental, nursing, or graduate school. Certain myths and misinformation are spreading around as well about tongue and lip ties, which are quite common. They don't exist, especially posterior tongue ties, because it's harder to see. Several myths are they don't cause problems with speech, feeding, or nursing. The frenum will stretch or the child will fall and rip lip tie eventually, which does happen but is not the best method of removing a lip tie. A quick snip with scissors will fix the problem. Unfortunately, there's a much bigger, deeper incision that needs to be done in order for it to be properly released. A baby or child would need general anesthesia or sedation to treat, which fortunately for us, we have not need to go to that extent. Many babies have nursing difficulties that don't resolve, or some issues that do happen with tongue ties. In addition, speech issues with R, L, S, T, H sounds is common. Speech delays, mumbling, and baby talk are also common with kids with tongue ties. Airway issues because the palate and nasal cavity is not expanded. So due to the tongue tie, the tongue can't rest on the roof of the mouth. So airway issues are quite narrow, and typically the patient may have a V-shaped palate. Snoring and sleep disorder breathing in children and adults is common. Feeding issues like difficulty transitioning to solids, swallowing foods, slow eating, picky eating, and reflux is common as well. Tongue ties can also cause several dental issues in the future: cavities, gaps, narrow palate, and braces. And mouth bleeding can lead to ear infections and enlarged tonsils, and adenoids is common also with kids with tongue and lip ties. So common speech issues we tend to have with tongue ties are difficulty with sounds that require tongue elevation, such as S, Z, T, D, L, and R sounds. Difficulty with sounds from the posterior aspect as well, the velar sounds, the G, K, N, and J sounds. Difficulty with speaking clearly or speaking quickly is common with these kids as well, so they may sound like they're having a baby talk situation. They're stuttering, lisping, or slurring words. Speech delay can occur if child has impaired tongue mobility as well. Although something releasing a tied down tongue is controversial, we have observed a difference daily, and others have seen the difference nationwide with the releases. Common sense suggests a restriction on the main muscle involved in speech production could have an effect on speech. Now, a great analogy to think of is, can you run a race with your shoes tied together? Feeding issues can also occur, such as a child may feel they're a very picky eater, especially with textures such as mashed potatoes, meats, etc. They can be a slow eater as well, difficulty swallowing, leading to slow eating and getting distracted while eating as well, possible trouble gaining weight. They tend to pack food in their cheeks like a squirrel. They spit their food out often as well. Feeding issues can also include swallowing whole with very little chewing. Reflux and constipation is quite common. Gagging on the foods as well if they're not able to swallow well enough, and unable to eat age-appropriate diet. Some children with tongue ties can also have sleep issues as well, such as sleep disordered breathing or sleep apnea, restless sleeping or thrashing around on the bed. Snoring is quite common. Waking up not feeling refreshed. You may notice the child may have some bags underneath their eyes. Waking often during sleep. Bedwetting. Tooth grinding due to stressful sleep. Mouth breathing, and sleeping in strange positions. So children with disturbed sleep due to a tongue-tie issue can have correlated issues as well, such as ADHD since they're not getting restful sleep, sensory issues related to it as well, tooth decay if they end up becoming a mouth breather with dryness and any carbohydrates sitting on top of the teeth can lead to tooth decay. Tooth grinding is common because of the stressful sleep. They tend to grind at night. Tongue thrusting as well due to an open bite. High or narrow palate is common, which is also the floor of the sinus, which can lead to also frequent ear or sinus infections. Neck and shoulder tension or pain can be common. Head aches and mouth breathing. So a tongue or lip tie release in our office is done with a laser. The beautiful part of the laser is that it's minimal to no bleeding. It's less painful than scissors or use of a scalpel method. There's better visualization of the procedure during the surgery. It's extremely precise. There's virtually no risk of infection since the laser will cauterize the blood vessels and there's no portal of entry into the blood system. No need for general anesthesia or sedation. It's very effective. It has excellent healing and less scarring compared to scissors. We use the highest quality surgical CO2 laser available that vaporizes the tissue instead of burning it like a cautery or a diode laser. To find more information about our laser, you can always visit our website at www.dfcsmiles.com-tongue/tie. So after the tissue is released with the laser, the oral wound healing is quite rapid. It heals by secondary intention. We encourage tongue movement and mobility as much as possible to prevent the area of reattaching. A wet scab can look like an infection or pus, but it is typically not. Increased drooling is common after the procedure as well. For pain, we typically recommend Motrin, but we also recommend alternating between Motrin and Tylenol. The area is sore for 2 to 3 days, but there is great improvement by day 5. If there are any issues or concerns, you could always give our office a call. So the aftercare exercises and stretches are crucial to help prevent the area from reattaching. This needs to be done to help prevent the reattachment and strengthen the muscles that have not been used and now have increased range of motion. A myofunctional or tongue exercises are key to a good result and should be performed as long as possible. At least 3 weeks and 6 would be better. Example exercises are on the next slide. Wound stretching or molding to elongate the wound and trick the wound to heal open should be performed for 3 weeks. The parent should wash their hands or wear gloves, place a finger at the top of the diamond wound, and lift the tongue up and back to put tension on the wound. Sometimes a second finger is needed at the bottom of the diamond. There will be some bleeding if the wet scab has healed back together and it is reopened. This is preferable to having it closed back together and having to repeat the procedure. We will schedule the patient for a follow visit at 1 week to assess healing and do a deeper stretch during that 1 week mark as well. The better the wound stretch is performed, the less likely there will be need for a deeper stretch. The tongue exercises listed here are helpful to prevent the tongue from reattaching. First and foremost, a myofunctional therapist is a great asset and part of the treatment team. Please ask us for references if you do not have one already. Typically, in the email that is sent to patients with our report that are sent to them in the email, a list of providers are given. Example exercises to help with healing are described below and should be performed about 3 times a day or more often if desired. One exercise that can be done is sticking the tongue out all the way to a point, not flat, by scraping the edge of the top teeth and pull back and lick the top of the palate about 20 times. 10 times by sticking the tongue out to the left all the way and to the right all the way and touching the palate as well. 10 seconds each would be great to push the tongue into the cheek on the right side like a gumball and to the left cheek like a gumball as well for 10 seconds. Sticking the tongue out down to the chin as far as possible and holding it there for 10 seconds. And then this is what we call a palatal suction. Suction the tongue to the palate and open widely and hold for 10 seconds. We do not guarantee results and it is not 100% effective. Speech or feed therapy and performing exercises is required to help improve the mobility of the tongue and improve functionality. We make our diagnosis based upon functional issues for the child and related symptoms the child may be experiencing combined with the clinical exam and the amount of restriction present under the tongue or lip. We do our best to achieve a full release even if it may have been clipped incorrectly one or several times by another method. We use the latest technology, protocols, and most current methods to provide our patients with the best results and experience possible. We do educate patients and our parents to ensure the child has the best chance of a good outcome, and we partner with our colleagues like speech therapists, occupational therapists, and myofunctional therapists to perform the bulk of the rehabilitation and help the child achieve normal function. The release is typically an adjunct to the rehabilitation. If you have any questions or concerns regarding this, feel free to reach out to us. Visit our website at www.dfcsmiles.com-tongue/tie or visit us at our office in Clifton, New Jersey. Thank you.